Disclaimer: the video pertains to my personal experience with aplastic anemia. Please do not take this as medical advice, as I am not a medical professional. Everyone experiences the disease differently, and if you are experiencing medical issues, please consult your physician. Thank you. Hey, what's up everyone? My name is Mark, and today I'm going to discuss the ATG treatment for those diagnosed with aplastic anemia. Today's video is going to be split up into 3 parts. 1, what is ATG? 2, my experience going through the ATG treatment. And 3, tips and advice for those about to undergo treatment for ATG. ATG is short for ATGAM, and ATGAM is then short for antithymocyte globulin. According to oncolink.org, ATGAM is a polyclonal antibody or immune globulin given as an intravenous infusion. ATGAM is used to fight a type of white blood cell called a T lymphocyte. T lymphocytes are part of your immune system. In some blood disorders, T lymphocytes might attack your bone marrow by mistake. This makes it hard for your bone marrow to make healthy blood cells. ATGAM stops or slows the T lymphocyte cells from attacking the bone marrow so your blood is able to make the cells it needs. In layman's terms, if you think of your body as a car and your bone marrow as your engine has stopped working. So what ATG does is that it goes in and it repairs your engine and it restarts your car. ATG is used for a multitude of purposes in the medical world, but in this video, I'm only going to cover it as a treatment for aplastic anemia. Depending on your hospital, they may choose to undergo the bone marrow transplant with you or the ATG treatment. Because the ATG treatment is a far less intense procedure than a bone marrow transplant, a lot of hospitals have made that their first line of defense against aplastic anemia in recent years. Upon receiving treatment of ATG, you might receive some of these side effects: fever, chills, itching, swelling, hives, trouble breathing, low blood pressure, nausea, and vomiting. The goal of ATG is to get your blood counts to a normal level so you can go back to resuming your life. Your counts will start to improve from between a month to 6 months. It depends on how you respond to the treatment. While you're on ATG, you will likely be prescribed 2 oral medications, cyclosporin and Promacta. Cyclosporin is an immunosuppressant that allows the ATG to go in and work on your body. And Promacta helps increase your platelet count. My doctors informed me that the treatment has a very high success rate and that I should be very optimistic about my prospects going forward. And I'm still here, so clearly the treatment works. I received the ATG treatment at Moffitt Cancer Center in Tampa, Florida in January of 2019. My stay at Moffitt was 6 days long, with 5 of those days receiving the ATG treatment through an IV. Now, before I received the treatment, the ATG cyclosporin Promacta route was only recently approved by the FDA, so there was a lot of reason to be anxious and I feared the unknown. However, with the love and support from my family and friends and the doctor's confidence in the treatment, I felt ready to go. To help me feel better, my family and friends were calling the ATG serum the Super Soldier Serum, as you've seen in the Captain America movies. Unfortunately, it didn't give me the biceps, pecs, and abs of Steve Rogers, so maybe next time. Before I got treated with ATG, Moffitt inserted what's called a PICC line into my arm about right here. And what that's able to do is they're able to draw blood from you, and they're also able to insert medication. My first day was relatively easy as they underwent tests to ensure I didn't have any underlying infections. My family was allowed to visit me during my treatment, however, that might vary depending on your hospital. At the end of the first day, the nurses gave me a tiny vial of ATG and stuck it into my arm about right here to see if I would have an allergic reaction, and thankfully I didn't. Now, the second day is where the real fun began, as I received my first bottle of ATG. To psych myself up before treatment, I blared "We Will Rock You" by Queen and also "Make a Man Out of You" by Mulan in my hospital room, and either my hallmates hated me or loved me because of that. Because I told Moffitt I'm a big baby when I'm sick, they gave me a lot of anti-nausea medication, which included IV Benadryl, and holy Toledo, that knocked me out. Along with Benadryl was IV prednisone, which is a steroid that keeps you awake. So my body was very confused. It didn't know if it wanted to nap for 10 hours straight or if it wanted to run a marathon. So it was a very interesting experience. After they loaded me up with the anti-nausea medication, I received the ATG, and within the first hour, I did spike up a neutropenic fever, and my nurses were on top of it. I think there were 4 or 5 of them in my room. They gave me Tylenol, and they checked my vitals every few minutes, and they were able to get the fever down very quickly. After that, and the Benadryl and prednisone began to wear off, I had ATG going for about another 3 hours, and I tolerated it very well. As I continued receiving ATG throughout the day, I was watching movies, talking to my family and friends, and really just hanging out. And I was very lucky that I did not have a lot of side effects that many people get when they undergo ATG. Days 3 through 6 were the same thing, where I received the IV Benadryl and IV prednisone before I received the ATG. And the days were uneventful. I had little to no side effects. Now, I did receive a few blood and platelet transfusions during my treatment. However, that was to be expected, and the only issue I had was through the blood transfusion, which made my mouth taste like metal, and it was disgusting. Just imagine drinking orange juice out of a metal container. It was not fun. After I was discharged from the hospital, I did continue taking cyclosporin and Promacta for about 13 months. The next few weeks, I did not see my counts go up, so I did receive some blood and platelet transfusions. However, in the middle of February of 2019, my counts did start to go up, and I no longer required transfusions. Slowly but surely, my counts started to go up. And by August of 2019, I was at a point where I was able to resume most of my normal activities. Depending on your hospital, you may not be able to bring in some of the items that I'm going to recommend bringing during your stay. So keep that in mind and ask your doctors if you're able to bring all of these items with you. Items to consider bringing: multiple phone chargers, streaming device such as a Roku or Amazon Fire Stick. Some hospitals may allow a gaming console such as a PlayStation or Xbox. Snacks, comfortable clothes, slippers, pillows and blankets, and a shower caddy. And some advice that I'd like to offer while you're receiving ATG. If you are receiving IV Benadryl before the ATG treatment, ask your nurse to administer it slowly. IV Benadryl made me feel very dizzy and uncomfortable, and administering it at a much slower pace made me feel a whole lot better. Take up your family and friends' offer when they ask what they can do to help you. Have them check your mail, bring food to the hospital, or FaceTime with them. A lot of people genuinely want to help you, and taking them up on their offer will not only help you feel better, but it'll help them feel better as well. Probably the most important piece of advice I can give you is to rest. Your body is going through a lot right now, and you need to chill out and you need to sleep as often as you can. Of course, if you underwent the ATG treatment and I forgot to mention some important pieces of advice or tips, please feel free to comment down below. To wrap everything up, going through ATG is a scary process, but a lot of people have undergone it and many have fared very well. There's a lot of reason to be hopeful and optimistic. If you listen to your doctors and nurses and you have a strong support system behind you, you can get through ATG. I know it. You just got to be hopeful, you got to be strong, and you got to be brave. Thanks for watching my video. Please don't forget to like, subscribe, and maybe share it with your friends. It's my goal to use this channel as a resource for those recently diagnosed with aplastic anemia. Thanks so much again, and hope you have a great rest of your day. Bye.